Nasal cavity is divided into two by nasal septum. Problems arise when it is not dividing it symmetrically, leading to a condition known as DNS, or deviated nasal septum. Causes of DNS. There are 4 important causes. Number 1 is trauma. 2 is developmental, or abnormalities acquired during the formation of nasal septum. Number 3 is racial. Some races, like Caucasians, have more incidence of DNS. Number 4 is hereditary. Some families have more incidence of DNS. Clinical features of DNS. N is for nasal obstruction. Naturally, any deviation in nasal septum causes less nasal space and results in nasal obstruction on the side of DNS. A is for insomnia. Patient is unable to smell, as there is failure of inspired air to reach the olfactory region. Loss of smell may be partial or total. S is for sinusitis. Since all sinuses have only one opening, and that's in the lateral wall of nose, DNS causes obstruction of these openings due to nasal obstruction. E is for epistaxis. E is for external deformity, particularly in young females or males who are more conscious of this. M is for middle ear infection. DNS also predisposes to middle ear infection because eustachian tube, which is the only drainage source of middle ear, opens in nasopharynx, and DNS can cause its obstruction and resulting in middle ear infections. Treatment. Minor cases of DNS require no treatment. If the symptoms are severe, then on reaching the age of 17, we can opt for septoplasty, in which the most deviated parts of nasal septum are removed, and the rest of septum is corrected and repositioned.
So we just did a endoscopic septoplasty, and we can hear. Giyasuddin, এখন ভালো নিঃশ্বাস নিতে পারছো তো?
খুবই ভালো লাগছে, বিশাল।
এরকম নিঃশ্বাস কত বছর আগে নিয়েছিল?
8 বছর আগে। আমাকে মনে হচ্ছে আজকে জীবনে প্রথম নিঃশ্বাস নিচ্ছি।
ঠিক আছে। So this is our on-table results. was there. Now we can see after Koana, we have removed the deviation endoscopically. We have also reduced the size of inferior turbinate, which was very big and obstructing the nasal valve area. So we have removed we say this procedure as inferior turbinoplasty. So we have done an inferior turbinoplasty, and we can see a big nasal cavity now, and patient is happy with the results.